So this is part 2 of a webinar series that is hosted by the Oregon Healthcare Authority and the Northwest ADA Center. This is a series that's focused on the ADA, or Americans with Disabilities Act, in healthcare spaces. For more information on this collaborative series, again, you can go to our website and we will be providing information after the webinar. With that, I am going to hand it over to today's primary speaker, Dr. Katie Warden.
Thanks, Heather. And thank you everyone for being here. So I'm going to move to our next slide and go over our agenda for the webinar today. So first, I want to just briefly talk a little bit about our intention with this webinar series and why we want to involve you all in learning more about the Americans with Disabilities Act. And then the content of our webinar is going to focus on really understanding physical and digital access as a civil right, as part of our civil rights as people with disabilities. We're going to overview some of the basic ADA accessibility requirements. We'll talk about accessible medical diagnostic equipment. There's some new proposed rulemaking around this area, and there's been some recent reports from key disability organizations about the importance of accessible diagnostic equipment. And we'll talk a little bit about telehealth and some emerging issues there. In the next webinar series, we're going to talk more about telehealth and effective communication. We'll also have time for question and answer, so please reach out, ask any questions you have. So as Heather mentioned, this is a collaboration between the Northwest ADA Center and the Oregon Health Authority. We're hosting 4 webinars, as well as producing some on-demand videos, updating some fact sheets that we have about accessible healthcare. And we've created a website that hosts these resources. And we're really hoping that this is information that's practical, that people can put in use to make their healthcare practices more accessible, and that people with disabilities can use to know more about their rights and what we have a right to access. So let me tell you a little bit about the Northwest ADA Center. We're an ADA center that's part of a network of national ADA centers. There's 10 of us, and on the slide right now, there's an image of the 10 regions, the 10 different ADA centers, and we're Region 10. We provide information, we answer questions, we do trainings on the Americans with Disabilities Act, and we were funded because the government understood that this was a law that might not be common sense to many people. That once it was passed, people would need assistance figuring out, what does it mean to make my healthcare practice accessible? And so that's what we're here to do. And I also want to share a little bit about myself before we jump into more of the content. So I'm a sociologist and a lawyer. I also identify as a person with a disability. I have a chronic illness, type 1 diabetes, and I have a learning disability and a couple of mental health conditions. And I'm sharing that with you, maybe in part because people like to talk about themselves, but really because in disability activism, we're encouraged to share and make explicit our relationship to disability, because how we relate to disability can shape our perspective on disability rights. It can shape what seems important to me, and it can shape what I might ignore or miss. And so my impairments, my disability, doesn't present in a way where I have physical access needs. When we talk about effective communication, and accommodations in our next webinar, those are parts of the law that have impacted my disability. And I just want to make that explicit. Heather, who introduced us, she also might be presenting. We might go back and forth and do a little Q&A. And so I've got her name listed on this slide as well. So we're going to talk about legal requirements today. And I just want to give a little disclaimer that as we're talking about the law, this isn't intended to be legal advice. It's just general information. And it's also, although this project, we're in partnership with Oregon Health Authority, the Northwest ADA Center is typically funded by the Administration for Community Living. And so even though we're funded through the federal government, the information we're sharing might not reflect or isn't endorsed necessarily by the federal government. Just a disclaimer. Okay, so today is learning objectives. First, I really want to emphasize that physical and digital access are civil rights. This isn't about a building code or checking things off of a list. This is about creating a world that's inclusive and accessible to everyone. I want us to become familiar with some general requirements for accessibility. And we're going to talk about how the ADA applies to public and private healthcare providers, the general way we're supposed to make our healthcare services accessible. I'll introduce you to the ADA standards for accessible design. And we're not going to dive deep into the technicalities of this. I want to introduce these standards that are tools that we can use to make sure that what we're building is accessible. And then I'm going to share resources so that when you have a specific question about, gosh, we're remodeling our practice and we're thinking about changing the door and what are the requirements there? All of that information, it's available online. There are entities that can help you figure out how to apply these standards to your specific practice. And then I want to touch a little bit on telehealth and just let you know about a key issue that's come up that's been brought kind of to attention by the National Association for the Deaf. And I'll share a fact sheet and a position piece they have on that issue, as well as some guidance that we have from the Department of Justice. Okay, so access as a civil right. Before we jump into things, I just want to frame our discussion by talking about these ADA standards, these requirements for accessibility as part of how we make a more inclusive world, as part of our fight for civil rights. Sometimes these standards, gosh, they really do get brushed to the side as technical details that don't matter. But these technical details are keys to creating access. And so I'm going to introduce kind of some ideas about disability that I hope can frame our discussion today. So in our first webinar, Heather talked about different frameworks or ways of thinking about disability. And we tend to think of disability through what we're calling a diversity framework. And so this is in contrast to kind of older views on disability that might see disability as a medical problem, something that's wrong with someone. We're thinking about disability as part of human diversity. And in fact, we're thinking about disability more specifically as the interaction between our body and mind, the way that I happen to be in the world with an atypical brain, a pancreas that's missing some pieces, right? I've got this embodied way of existing, and disability is what happens when I interact with an environment that might not be set up, assuming that everyone has unusual minds or organs that don't work quite like everybody else's. And so in a diversity framework of disability, disability is what happens when our bodies meet an inaccessible environment. And so on the slide right now, there's a bullet point that I want to read. It says, individuals may have non-typical or impaired functioning, but it's societal barriers that disable individuals. So we're shifting our focus to be thinking about the environment and the way it interacts with us. And so on this next slide, there's just two images to really emphasize that this isn't about the body-mind, right? It's about the body-mind as it interacts with the environment. And so the images are two arrows facing each other. And one arrow has the words body-mind, the other arrow has environment. And so disability is what happens in that moment of a non-typical body-mind meeting an environment that's not built for our needs. And I want this framework, right? When we're thinking about accessibility and building kind of parking lots and entryways, countertops, the check-in part of your office, when we're thinking about those spaces, think about how those details can interact with all the various diverse ways of existing in the world, and whether or not the way your environment has been structured is going to support people, or if it's going to be a barrier. What's the interaction between the details of your healthcare practice and the way that people exist in the world? And so the Americans with Disabilities Act, it actually takes this kind of critical perspective on disability into consideration. And we see that in the congressional findings. So on the slide right now, I have some language from the findings section of the Americans with Disabilities Act. And this is the part of the law where Congress is explaining, why do we need a civil rights law? Why are we going to put all this effort into creating the system of civil rights? And so I've picked out kind of two key pieces for our discussion today. And so I'll read the text. Congress finds that individuals with disabilities continually encounter various forms of discrimination, including the discriminatory effects of architectural and communication barriers, and the failure to make modifications to existing facilities. Right? So this law is in response to the reality that the world wasn't necessarily built to include all bodies, all ways of being, all ways of communicating. Okay, so from the research, we know that there are common barriers to accessing healthcare for people with disabilities. We're going to jump into those barriers and then talk about how the ADA responds to these barriers. So one way to think about the different kinds of barriers that people can encounter in an environment is to think about architectural barriers and communication barriers. And so architectural barriers impede access for people with mobility disabilities. And these barriers can be obvious, things that we're thinking about already all the time, right? We're thinking about steps and curb cuts and ramps, right? We're thinking about kind of these big fixtures in the environment. But architectural barriers can also include smaller pieces, like where the drinking fountain's placed, where are the paper towels in a bathroom, what kind of door handles are you using in your office? Communication barriers can also be structural. And so there's a part of the law about effective communication, and we're going to talk about that in our next webinar. But right now, when I'm speaking about communication barriers, I'm talking about the information in a healthcare practice, for example, that would allow someone to know where am I going to find the doctor's office? How do I know which provider I'm going to meet with today? And how do I know where the emergency exit is? So in our built environment, there's communication embedded in signs and displays, and this information, if it's not accessible, if it doesn't follow these standards, can also be a barrier. Okay. So people encounter barriers throughout a healthcare facility, throughout other facilities, right? And in healthcare, it's key to think about barriers that people experience when they're entering and navigating the facility, right? How do they get into your building? What's the parking lot like? Once they're inside, how do they find the right office? What's the check-in space like? What's the waiting room like? Do you have a kiosk that's accessible? What about your restrooms? And then what about the examination room? And we have specific requirements or guidelines and how to make all of those spaces accessible. The next place that people experience barriers in healthcare that I want to highlight is in accessing medical equipment. And so here we're talking about scales, talking about chairs, examination tables, and then other equipment like mammography machines. And we'll talk a little bit more in detail about medical equipment later on. Okay, so I briefly want to talk about or highlight the effects of these access barriers. I tend to not like to emphasize or focus on kind of the negative effects that people with disabilities can experience because of discrimination, in part because I like to emphasize the positive, what we can do. And but I do want to note that we have research where we're tying kind of negative health outcomes to inaccessible facilities. And so some of the negative health outcomes are that people with disabilities less likely to receive preventative care, less likely to have dental visits regularly, less likely to receive diagnostic imaging. The CDC has actually sponsored a campaign to help women with disabilities access breast cancer screenings because so many facilities are inaccessible and women don't have that access. Okay, so what does the ADA require? If you're not an architect or you don't think very kind of, I don't know, I don't think like a designer, this can feel pretty overwhelming. Gosh, I really don't know exactly the measurements of all of the spaces that I need to follow to make things accessible. But the ADA gets into that level of detail. So we're going to start by looking at just kind of overarching, what does the law require, get into some of the standards and how they apply to new buildings and old buildings. Okay. So the ADA, the Americans with Disabilities Act, it's a civil rights law. It's an anti-discrimination law. So it requires healthcare providers to make their services available in an accessible manner. And this really means that healthcare providers must provide people with disabilities full and equal access to their healthcare services and facilities, reasonable modifications to policies, like bringing a service animal into the practice, and effective communication. And we'll talk about those last two prongs in the next webinar. It also prohibits outright exclusion. And I've included that bullet point on exclusion because we do see this and we do have research supporting or kind of letting us know that sometimes providers, they will refuse to see people because their facilities are inaccessible. They might say, well, no, I don't have a scale that someone in a wheelchair can use, and so I can't see you. We also see that they oftentimes just ask people to guess what their weight is, but we'll get there in the medical diagnostic equipment section. Okay, so that first bullet point, full and equal access to healthcare services and facilities. We do that by applying the ADA standards, okay? So these are design and construction requirements on how to make spaces accessible. And these design and construction standards outline what is required for a building or facility to be physically accessible. And so I have an example right now on the slide. It's an image of different door openings and measurements to show where doors can be positioned with enough maneuvering space around the doors and where handles are located, how many inches the door is from the wall, and where that's in relationship to an accessible route that someone would use to move through that space. And we have ADA standards that cover kind of moving throughout the parking lot through the facility. And I'll show you some more examples here. So this is on this slide, I've got images from the guide to the ADA standards. So we have those standards that are the technical, this is where the door is, this is where the accessible route needs to be in relationship to that, this is how much space we need. We also have a guide to those standards, and this guide has more illustrations, more tips, more explanation and recommendation. It's a way of, it's intended to help us implement those technical requirements. And so the two images I have on the slide right now are examples of accessible parking spaces and accessible routes. And they include commentary from the access board, which is my next slide, that explain kind of where curb ramps are provided. They can't protrude into access aisles, which can't slope more than a certain degree. And so I'm using these just as examples. There are images and drawings, explanations like this for many parts of a facility, and you can find those online. So online, you can find those standards and the guides at the US Access Board. And you might not know who the Access Board is or have heard of them. It's an amazing federal agency. It's an independent agency that created these standards, right? They created the designs for how to make spaces accessible. And they also provide technical assistance on how to implement these standards. And so I've got on the slide right now just a screenshot of their technical assistance webpage. I've also got a link to their website. And I want you to know that you can call the Access Board, the people who made the standards that tell us how to make spaces accessible. You can call them and ask questions. You can ask, hey, I'm thinking about, we're thinking about installing a ramp here. What do you all recommend? Should we go this way or that way? How do we make this work in our specific facility? You can also email them designs and pictures, and they can give feedback on whether or not things are does it look like what they intended when they created these standards? And this is a great resource. You can call them Monday through Friday. Okay, so the ADA says we have to provide healthcare in an accessible way. People need to access our healthcare facilities and services. And to do that, we follow these design guidelines. And that's kind of simple if you're building a new building, right? If you're going to design a new dental practice, you follow the ADA standards. That's how you make it accessible. And so the law does require that all new construction has to be readily accessible and usable by people with disabilities. And that means this new construction must align with these standards. Whenever you're altering a building or a facility, and this is kind of alterations such as kind of changing parts of the facility that affect the way we use it. So maybe changing walls, or where kind of the location of different rooms, kind of bigger design changes. Those also have to be in alignment with these standards. Kind of normal maintenance doesn't have to be, if it doesn't affect the usability or the way people move about in space, the purpose of the space. So for new construction, we know what to do, follow these standards. But as we all know, the world's been built, right? Much of the world's already in existence. And much of those spaces aren't accessible, right? And so we do also have guidance on what to do. Now we've got the space, ooh, it doesn't quite align with the standards. What do we do next? And so here the law distinguishes between private providers and public providers. And so if you're a healthcare provider that's part of a state or local government agency, your requirement is to provide what's called program access. And so this means that if one of your spaces is inaccessible, you need to provide the service in a different facility that is accessible. But you don't have to make all of the inaccessible spaces accessible, as long as you can provide the healthcare service in a place that is accessible. Whew, that was a lot of accessible words there. So please feel free to ask questions if you have questions about program access. It is a more complicated legal requirement. And then for private providers, so you're a independent dental clinic or a healthcare provider in private practice, the ADA requires you to remove barriers when it's readily achievable. And so readily achievable is about balancing the cost of a change, of making something accessible, with the size of the business and the business's resources. And so a healthcare provider with more money, more resources is going to be required to do more barrier removal. And so when you're thinking about barrier removal, what is it that we've got to, we've got to address some of these barriers that we're aware of. Some of them are readily achievable, maybe, some aren't. We've got priorities on what a business or a private entity should focus on when removing barriers to access. The first one is think about how do people get into the healthcare practice. So you got to provide access from public sidewalks, from the parking area, from public transportation. Once people are inside the building, how are they going to access your services? So making sure there's an accessible route throughout the building, making sure there's signage that lets people know where to go. So once we're in there, and then access to restrooms is a key priority. And then removing other barriers to amenities that are offered to the public or your patients. And so sometimes this can be kind of drinking fountains or drinking fountains that kind of making sure that other amenities, other parts of your business are accessible. But the key three are the get into the building, move around the building, access the services, get to the examination room, and making sure that there's access to restrooms. Okay, so what do? How do we implement this more practically? The law gives us these requirements. We know where to go to find out the details of how to make our spaces more accessible. What do we do next? The first step is to evaluate how accessible your healthcare setting is. And this can be a pretty simple or pretty complicated step. So we want to look for barriers. And we're thinking again about those key priorities of getting into the space, moving around the space and accessing services and restrooms. So here, these are some places where we would evaluate for barriers. The approach to the facility, information in the building and getting to the provider's office, the check-in space. What's your waiting room like? What's the check-in countertop height? Is there a kiosk where you're asking people to start the check-in process? And is that accessible to someone who's using a wheelchair? Is it accessible to someone who's blind or has low vision? What about your restroom facilities? And then the clinical examination. So, got some kind of general places where we're going to look for barriers, think about where people can experience barriers. And there are many tools that'll help you identify these barriers. So on the slide right now, I've got an image of our checklist, actually. The Northwest ADA Center made a checklist that has kind of key guidelines, key things to look out for that you can use to go throughout your medical facility or your healthcare clinic and address and look for accessibility. And this checklist, it incorporates some of the Oregon specific standards. There are many of these checklists online though. And when we post the slides as part of the webinar recording, we'll have details of different checklists you can use. Some are more detailed, some are simpler, some focus on specific areas in a facility. So there's a lot of resources out there. And so I wanted to take some time to really talk about what does this checklist look like? How does this thing work? And so typically, checklists will start by giving some basic instructions on what to do. What tools do you need to start this process? And so on the slide, there's two images that are just the front pages of our Oregon Health Facilities checklist, and also a checklist from the Mid-Atlantic ADA Center that's focused on healthcare facilities as well. And so both of these checklists, they start with kind of make sure you've got some measuring tape. It's a good idea to do this with more than one person. Have a clipboard where you can take notes, right? So they really do break things down so that you can kind of do this on your own in your practice. But it's a good idea to have some friends or a couple of people help you. So now on this slide, I wanted to show you some more images of these checklists. I've got two images here from our Oregon Health checklist. The first one is about accessible parking. And so in this image, accessible parking. People with disabilities should be able to arrive at your business and easily locate and use accessible parking. And so then under that, there's a question and it says, does your facility provide accessible parking spaces designated for use by individuals with disabilities? And then there's some checkboxes, a yes and a no. There's also an image of an accessible parking space next to that. And then underneath that, it goes through and talks about the number of accessible spaces that you might need, depending on how many parking spaces you have in total. On the second image on the slide, it's about accessible examination rooms and medical equipment. And so here we've got kind of the first thing on the checklist is, do all interior accessible routes to and through examination rooms have a clear, unobstructed width of 36 inches? And again, there's the check boxes, yes and no. And so if that feels terribly overwhelming and not very helpful, I'm sorry, I'm not a design person, so it's a bit overwhelming. And I want you to know that there's assistance out there to help you with this. So first on this slide, I've got a link to a partner organization. So you can reach out. There are experts who do this work professionally. They are experienced in it. They can come out to your facility and evaluate it. And so I've just had a link to kind of our partner organization. They're also based out of the University of Washington. They're called ADDIE, Accessible Design and Innovative Inclusion. And I just want you to know that these organizations exist. There are resources like that. And then my next bullet point is just disabled people. Because I want you to know that people with disabilities, right, they are also the experts in figuring out, ooh, is this accessible? Isn't that accessible? And so I've got a link here to the Oregon Independent Living Center homepage. And so they're independent living centers or kind of advocacy organizations for disabled people throughout Oregon. And you might consider reaching out to one of those centers to ask about, do you all do reviews? Do you come out and access facilities? I happen to live in Idaho, and our independent living centers in Idaho do this kind of work. And so it's a good resource. And then of course, remember the access board. Okay, I wanted to highlight an Oregon project for you all. It's a really great example of how we can use these self-evaluations, these checklists, these audits to increase access. And so this mammography accessibility project, there's a link to the website in the materials. It's based out of the based out of OHSU. And what they did is they went out to different healthcare facilities throughout the state. They have a detailed checklist, and then they have a simpler checklist. And they've posted these results online to let people know, is there an accessible mammography machine at this healthcare facility? Kind of as part of a larger review of the facilities to let people know, should you try to go here or there? Where is the accessible equipment? And so on the screen right now is an image of one of the pages in their checklist that's specific to mammography machines. And so this is going to lead us into talking about medical diagnostic equipment, right? So we were thinking about access to healthcare, getting into the facility, getting into the exam room. And then, do we have the equipment that's necessary for people to access the healthcare services that you provide, to access diagnostic equipment, to access, different kinds of testing that we might do. So on this slide, I've got some examples of accessible diagnostic equipment. And some key ones to think about are tables and chairs that are height adjustable. Are your scales, do you have wheelchair accessible scales? Is the radiologic equipment adjustable height? Are there lifts? Are your kind of gurneys or stretchers accessible as well? And so then at the bottom, I've got a sentence that kind of, why does this matter? What's going on here? And what's really key is that people with disabilities receive medical services equal to those received by non-disabled people. And we need accessible scales. We need accessible mammography machines in order to receive those equal services, right? So this is a key component of the legal requirements. And on this screen, I've just got two images from the Department of Justice, one of their guidance documents on accessible medical equipment. So on the left, there's an image of an accessible mammography machine. And on the other side, there's an image of an accessible scale. And I've highlighted these two kind of types of equipment, mammography and scales, because our research really focuses or highlights how these two types of equipment have led to lots of barriers for people. The lack of having accessible equipment like this. Okay, so there are some recent legal updates specific to equipment. The National Council on Disability is a federal agency that advocates for disabled people, for disability issues. They research disability, produce reports, great resource. In 2021, they produced a report on inaccessible medical diagnostic equipment. And I've got a quote from their report on the slide. It says, people with disabilities reported that healthcare professionals often created ad hoc accommodations due to inaccessible MDE, medical diagnostic equipment, that included skipping parts of examinations during which a barrier was encountered, or even refusing to treat the patient due to the facility's inaccessibility. And so I want to share an example that came out in this report of a woman who had gone for a breast cancer screening, and she was using a wheelchair, and her provider wanted to do the exam, while she was seated in her wheelchair. And she felt, right, oh, this isn't right. I need to be led down, which is typically how those procedures are, like how a breast exam is performed. Someone's led down. And because she was sat in her wheelchair during the procedure, this medical provider didn't catch an abnormality. And it wasn't until she found a provider who had accessible equipment that her breast cancer was detected. This report also highlighted how common it was for people to not be weighed, for wheelchair users to not be weighed, and instead for healthcare providers to simply ask them to estimate what their weight was. And on those guesses, those estimations, they would make diagnostic decisions. And so kind of this report came out in 2021. The US Access Board, kind of these experts in the details of making spaces and things accessible, they've created standards for how to ensure this equipment is accessible. And now the Department of Justice is in the process of making regulations to incorporate these requirements, these specific details of how to make the machines accessible. And so there's some links to resources on those legal updates on the slide. Okay, so issues in telehealth. We're only going to talk about telehealth briefly today because it's going to come up when we talk about effective communication next time. But I wanted to highlight kind of two issues with telehealth. If we're thinking about telehealth as a space, right? We're thinking about digital space. This is part of the built environment, and this is the environment that our bodies interact with this environment, and it's in that moment of interaction where we experience disability that leads to disability, even if we're taking a critical perspective. So first, on this slide, I've just got some kind of basic guidelines for ensuring digital access. There's also a link to a fact sheet because there's proposed rulemaking on web accessibility happening as well. So make sure that content is accessible with a screen reader. Make sure there's alternate text for pictures or graphs. Make sure that websites or telehealth platforms can be navigated with a keyboard, not just with the mouse. Don't rely on color to convey meaning. And last, provide captions or transcripts for audio and video content. So that's really basic. And this link kind of will take you to some DOJ guidance there that takes you to even more detailed guidance on how to make this real. So when we're thinking specifically about telehealth, I wanted to highlight this issue for you all, and it's to ensure that whatever telehealth platform you're using, that it allows third parties to join. And so what we're seeing is that some of those platforms don't allow for that. And so that means that people who are going to use interpretation or people who are going to work with a support person can access the healthcare services if the telehealth platform doesn't allow for a third party to participate in the appointment. And so I've got two links on the slide that are resources. One is from the National Association for the Deaf, and it's some guidelines and a position statement from them. And then telehealth ada.gov just gives some kind of, if you needed a clear resource that you could share with someone to say, yes, you do have to ensure that telehealth, that the platform allows an interpreter to join, you can go there and find that. Okay, so I've gotten to a key resource that I wanted to share with you all. I think it's really an excellent source of information, and you can use it as a refresher as well. So this is an online training course that you can access through HHS. And this link, there's a link on the slide as well as a screenshot of the training course homepage. And there's kind of guidance documents. There's also an online training you can take. It walks you through kind of different steps. It has examples of checklists, very simple checklists, more detailed checklists. And it's all kind of plain language, really intended to be user-friendly and something that you can implement and go back to. And I just wanted to highlight that resource to make sure you all were aware of it. Okay, question and answer. Thank you all so much for your patience and for being here and participating. I'm looking forward to questions.
That's great. This is Heather speaking. Thank you so much, Katie. We do have a handful of questions in here and a number of comments. And I just wanted to start out reading a comment, and then I'll pose a question to you. This is a comment that comes from Alexandra, who says, as someone who has driven a bus, while the access aisle is big enough for the wheelchair lift or ramp, it's not always big enough for the wheelchair user to then leave the lift or ramp if someone is parked next to the access aisle. So they say, I've at times had to park further away to accommodate. So I was just wanted to highlight and amplify that comment about thinking about when planning parking spaces, etc., making sure not only that there are enough spaces, but that there's room on the different sides of the parking spot, particularly if they have, say, a van, etc., so that people can actually use the space. A related comment comes from Violet, who is the chairperson of the Hawaii Disability and Communication Access Board. And Violet says that they're finding that the minimum number of accessible parking spaces required by the ADA are simply not enough. and that therefore they are contacting entities asking them to consider allocating more parking spaces beyond the minimum. And that while this is a work in progress, but so far the responses have been really good. And in fact, they got one large box store who actually added more accessible spaces. And again, I wanted to amplify these comments because it really speaks to your point earlier, Katie, about why it's always important to include people with disabilities when designing our spaces to make sure that the specifications are not only, quote, in compliance, as you said, but that they also meet the needs of the folks that we serve and that we work with. So I wanted to amplify those comments. A first question for you, one that is close and dear to my heart. Someone asks, does the ADA also cover ventilation, filtration, and mask requirements for those of us who are immunocompromised? So many of us are currently unable to access basic care because spaces without COVID mitigation are not fully accessible. So I'm looking forward to your response to that.
Great question. I would consider that to come up when we're talking about reasonable modifications. And so that's kind of the next section, the next webinar, and a different part of the ADA. And so kind of you or an individual with a disability could ask, as a reasonable accommodation or modification, doesn't matter which word you use, that providers wear masks, that they install a specific filter, or that windows are open, or that there are other types of protective equipment or changes to the space to make it more safe. When kind of in my previous life as a special education lawyer, I had a client who was kind of at high risk because of COVID. And so accommodations that we asked for were that people in the space around her were all masked. If people couldn't or refused to wear masks, that they not be in the space at the time that she was there. We did also request as accommodations that different filters were placed into this particular setting. And so I think, you know, that so much of how the accommodation process works kind of depends on who you're asking the accommodation from and their willingness to engage in the process. But that definitely is a request that people have made and that has been implemented before. What do you think, Heather? Do you have anything to add to that?
No, I was just thinking about so many anecdotes that relate to this specific question and thinking about your response. And I think it also goes to what you were talking about regarding telehealth, at least for so many of us. Mm-hmm. in the instances when we can, that telehealth has been that kind of accommodation if healthcare facilities don't feel safe. But again, that's not always an option. So thank you. Another question that has come in is from Sam, who asks about program access. And Sam asks, are there specific rules about distance or maybe providing transportation to an alternate accessible facility when the facility that they thought that they were going to go to turns out to not be accessible?
So this is part of the law where I think it's unfortunate that we don't have these clear standards in terms of kind of it has to be within the, you know, this specific distance. It would be, is the way that the program access piece is evaluated is thinking about overall, are people able to access the program in its entirety as a system. And so deciding whether or not one space with, you know, one building is this far, another building is that far, it would really come down to a case-by-case analysis of kind of what are the resources, how many buildings are there in the program? Maybe there's 5 healthcare providers in that setting or group, and they're kind of working through kind of balancing the program as a whole with an individual's access to a specific specific facility. So no, this is in some ways it's great that the law has this flexibility and kind of the case-by-case analysis built in. In some ways, I think that's really frustrating when we don't have clear answers. Sorry, Sam, I feel bad that I can't give you a better answer than that. But it really is structure of the law there that we would think about this in a case-by-case setting.
Great. Thank you so much,
Yeah.
Katie. So I want to say again, I want to amplify. We just put in the Caitlin just put in the chat that please take a moment to complete the feedback and complete a short survey. Also, reminder to those that are pursuing continuing education credits that they will need to complete this survey as part of that process. So we value your feedback. We look to tailor these webinars to the needs of the folks who attend them. So please do share your thoughts with us. And I have another comment that I thought might be worth amplifying for the group. Someone, Alexandra, writes in that when they were a caregiver, when clinics aren't accessible, that they've often been put in a position to then encourage or encourage clients to do things that really were uncomfortable, like standing for long periods of time for an injection, and just wanted to recognize that when our facilities are not accessible, it impacts not just disabled patients and individuals, but really all of us involved. And certainly a lot of the comments that have been coming in have been sharing examples and stories of inaccessible places. So again, I want to thank you, Katie. I'll let you talk about the next 2 webinar series that I think is, or webinars in this series that I think is going to just get us deeper into the importance of accessibility.
Thanks, Heather, and thank you, everyone. So our next webinar, we'll talk about effective communication and reasonable modifications. And our last webinar is going to be a panel of providers talking about how they practice disability allyship in healthcare. I'm looking forward to both of them. So appreciate you all for caring about this issue and being here today. Okay, thank you.
Thank you.